Governor Hochul has set up a 24/7 command center to monitor staff shortages as New York's first in the nation vaccination mandate for health care workers goes into effect.
Thousands of medical professionals remain unvaccinated, and repercussions are already being felt. CBS 2 political reporter Marcia Kramer now with the story.
When New York's precedent-setting vaccine mandate for medical workers went into effect at midnight, Governor Hochul signed an executive order to alleviate potential staffing shortages caused by the reluctance of some to get the COVID shot.
This is all about self-defense. I'm here to defend the people of New York.
The governor took a number of steps to shore up the medical establishment, including a 24/7 operations center to troubleshoot acute situations with healthcare providers, allowing out-of-state and out-of-country healthcare workers to practice in New York, waiving re-registration fees for retirees, and allowing doctors to treat nursing home patients using telemedicine.
We've sent out the alarm. We have a pool of individuals who want to help.
Meanwhile, there was some evidence that the threat of losing their jobs convinced some of the state's estimated 600,000 healthcare workers to take the jab. Preliminary data showed that 92% of hospital staff had received at least one dose of vaccine. The rate was 89% for adult care facilities, 92% for nursing home staff. Still, the vaccine reluctant are being shown the door. At St. Barnabas Hospital, a private hospital in the Bronx, 98 workers, mostly nurses and housekeeping staff, were suspended. They have until Monday to get the shot or face dismissal. New York City's 11 public hospitals reported 95% of nurses are fully vaccinated.
All of the hospitals in New York City are fully operational.
Kevin Surdy, a Long Island ER nurse, got the vaccine, but he doesn't think it's fair to force people to take the shot.
I am much rather get treated by an unvaccinated nurse than nobody at all. And that's what's going to happen. We are going to have short-staffed. We're not going to have enough nurses and doctors and other healthcare workers to care for patients when they come in for heart attacks and strokes and your kids being sick.
New York Presbyterian Hospital already instituted its mandate last week.
You don't want to shame anybody. Certainly no one wants to lose a job, and we didn't want anybody to lose their job. But we felt that that had to be the choice that people would make.
Well, meanwhile, the State Supreme Court Officers Association won a temporary restraining order to prevent the court system from implementing a vaccine mandate for the 1,400 men and women who work in courthouses in the 5 boroughs. Union President Patrick Cullen says members have the right to make their own decisions on health matters. Chris and Mary?
Okay, Marcia, thank you. Well,